Every year, women lose their lives to cervical cancer simply because it is detected too late. Yet, the disease is preventable and highly treatable when caught early. However, limited screening services and a shortage of trained health workers continue to stand in the way. Authorities say health workers must be equipped with the necessary skills and training to enable them tackle this public health crisis. Samuel Yeboah Adams reports.
Cervical cancer is a major health issue in Ghana. It ranks as the second most common cancer among women, with about 3,000 new cases and 1,800 deaths recorded annually. However, limited screening services and the shortage of trained health workers continue to stand in the way of timely diagnosis. At the forefront of effort to change this narrative is Dr. Kofi Effah of the Catholic Hospital Cervical Cancer Prevention and Training Center. Dr. Kofi Effah is passionate about training health workers to help eliminate cervical cancer.
Training in Ghana has traditionally been more theory-based. So we developed a practical approach to cervical cancer prevention, equipping people with not health workers, with not just knowledge, but also skills in cervical cancer prevention. We hope that women will not travel more than 5 kilometers to get access to cervical cancer prevention skills.
The Director General of the Ghana Health Service, Professor Samuel Kaba Korea, during a visit to the Catholic Hospital Cervical Cancer Prevention and Training Center, reaffirmed the government commitment to replicating the training modules nationwide.
We don't need to reinvent the wheel when somebody is already doing something so good within our country. So it's part of the reason to look towards a very successful free primary healthcare implementation with homegrown solutions that have come over the years, because he's been doing this for 9 years, and it's part of how to get to understand some of the intricacies and the challenges he's faced. So when we are rolling it out, it will not be a challenge.
For the Executive Director of the Christian Health Association of Ghana, Dr. Peter Kwame Yeboah, training health workers to screen for cervical cancer is crucial to prevention efforts.
Service provision is very important, but as well also the training and development of the next schedule of healthcare professionals is very important, including research and development.
Last year, Ghana launched a nationwide human papillomavirus HPV vaccination campaign targeted at girls aged 9 to 14 years to provide life-saving protection against cervical cancer, encouraging parents to have their daughters vaccinated, improving screening services, and training more health workers are critical steps toward winning the fight against cervical cancer in Ghana.